Welcome to another episode of Judgment Date. We've been doing these programs for some while now, basically to help people through the lockdown, try to make some sense of it, and to try to help people think through some of the pressing problems, whether they be legal, economic, or medical, with regard to this, as it were, a temporary series of programs during a very, very trying temporary time, hopefully. And today, I'm very pleased to have the chairperson of the South African Medical Association, Dr. Angelique Coetzee, with me. He's also been one of the expert advisors to the government. Dr. Coetzee, thank you very much for joining us. I wonder, the reason I suppose I asked you is because I've invited a couple of your colleagues who have also been advising the government on the expert panel, but people are really confused, if I could put it that way, as to precisely whether we've got a handle on this and where it all goes to. So I suppose let me start with, do we have a grip on this particular pandemic, we in South Africa at the moment?
Dennis, thank you for having me here. Unfortunately, I'm not a very person with a lot of tact. I'm quite straightforward.
I'm happy to have straightforward.
I tend to say it as it is, to the horror of some of the scientists sometimes, or some of my colleagues. No, we don't have a handle on this. There's two reasons why I'm saying that. And one is that if you look worldwide in most of the countries when they had their pandemic or when they went into the eye of the storm, as we call it, they also struggled. And then coming back to South Africa, only looking at the history of other countries, it is a given that we will struggle. But if you look at our past history of neglect of hospitals and the poor service delivery that we are having to sit with for quite a few years, the moratorium that was put on medical posts, and all the politicians around med or around health that is interfering in the health process. It's a recipe for quite a tough one, and making sure that we will not be having a smooth sail during these turbulent times. No, we are not ready.
But I mean, clearly we've had different sort of experiences, have we not? I mean, the suggestion is that the Western Cape has done pretty well under the circumstances, may well have passed the peak coming down the other side. Would you agree with that in relation to the Western Cape?
Yes, I will agree with that. The Western Cape, that's better. Remember, they are that province is a smaller, or if you look at the population, it's not as dense as places like Gauteng or as far apart as in the Eastern Cape. They started with negotiations a while back, and also they realized that they needed to get the buy-in of the private sector, and they were pretty open to negotiations and sat along, in meetings with the private sector, GP-wise as well as specialist-wise. Listen, also, although they had their own SLA and their own rules, but at least they were willing to listen, and they acknowledged the fact that if you have a field hospital, you need to make sure that there's enough oxygen points and all of the infrastructure that's correct. Unfortunately, all the other provinces did not have, or is not in that same category, don't fall in that same category, and doesn't matter what National Department of Health is saying. Each province is autonomic, and they can do what they want, and financially they can do with their money exactly what they want as they see fit.
So are you saying that for the other provinces, as I understand it, in fact, each and every one of them is in terrible trouble? Well, let me put it this way: people living in these provinces with the threat of COVID hanging around are actually under serious threat, because the medical workings in these provinces just are not going to be able to handle this pandemic.
Well, I cannot say categorically that it will be for all other 8 provinces, but the likelihood that they will have difficulties is definitely there. We can already see in Northwest They are struggling in places like Potchefstroom, Klerksdorp. We look at Gauteng. We can see that the hospitals in the East Rand, the hospitals in, or the big public hospitals are struggling. Private hospitals are struggling. You go and look at Eastern Cape, especially in Port Elizabeth. There is a lot of turmoil in some of those hospitals with very, very poor service delivery, and the doctors are complaining. You look at KwaZulu-Natal, just today, Prof. Merganaidu, who is part of my board, he was very worried about what is happening in the hospitals in KwaZulu-Natal, and so I can pinpoint them for you. Unfortunately, what we have seen, and this is where SAMA is extremely concerned, and what we see is that our members are telling us a different story at ground level that is going up through the ranks to provincial or national Department of Health.
So what are your members telling you? What are your members telling you?
Our members are very upset, especially in the public sector hospitals. Dora and Singzi, I think don't pronounce that last part correctly, but it is in the Port Elizabeth. They whistleblowed to us recently, last week, and where they are extremely unhappy in their hospitals. They are without running water in the casualties. There is not enough PPE. There is not, the X-ray machines are not working. Some of the other lab diagnostic tests that is extremely important are not working in that specific hospital. They've got one, in the casualty area, they've got one ventilator, and that was low. That was something that was one that they borrowed it from one of the other departments. There is only 8 oxygen ports. The casualty is not big enough for 1.5 meters. Families, there's a lot of things that is going
tell me something. Your members presumably are doctors who would ply their trades both in the public and the private sector.
Some of them will, yes. I'm sorry. I'm sorry. If some of the public sector doctors will work in public and in private.
Yes, what I'm trying to say is when we talk about your members,
yeah, it's both public and private
sector. So,
yeah.
I mean, it does seem to me what you're telling me is that if you're lucky enough to be able to afford the private care at the moment, you're still in far better shape than in the public hospitals.
You are better off, but only to a certain level. Because what we're seeing in the private sector, also, beds are full, and then the lack of qualified ICU staff, whether you need ICU beds, regardless whether it is for a ventilator or for all these oxygen requirements for very, very sick patients. And believe me, those patients getting COVID-19, that 6% that we are talking about that will need hospital admission are really sick patients. And so, you know, I know one of the private hospitals in the Pretoria region only have 3 ICU sisters for that whole hospital, and it's a quite a big private hospital. And the rest of the nursing staff is normal nurses, not trained in ICU. Also, what happened now in PE, in the private hospitals, what government did there, they came with contracts for and stole the nursing staff from the private sector by luring them away with better remuneration. So they lost a lot of their staff to go into the public sector.
Would it not be advisable, you know, I don't know, presumably it'd have to be a state of emergency, I suppose, for the public and the private sector to be welded together whilst we have this crisis, to have one system that works for everybody?
Yes, we are. What we have said, that's why I'm not sure whether you are aware of the service level agreement contracts that was negotiated between the Hospital Association, the Specialist and National Department of Health. Okay, but that's National Department. So that same service level agreement was a bit modified with the Western Cape, and they signed actually the contracts with, there was signed contracts saying that if I have a patient that cannot get the service in the public sector, can your hospital that you have signed an SLA with me, would your hospital be able to look after them? And yes. And the idea is not to say that this is a public patient or a private patient or a medical scheme patient. The patient is a patient. It is about the disease.
But is that only happening in the Western Cape, or is that happening all over?
Well, according to the the Provincial Department of Limpopo, they said they signed. Gauteng haven't signed yet. There's still a lot of uncertainty what is happening there, and again, I haven't seen
But they're in an eye of the storm. I mean, they're increasing more than anybody else. I mean, let me ask you about this. How reliable are these figures? The death rate seems so low. When I look at the looking at the projected deaths from natural causes, if you look at it's done through UCT, all of the years that they've done it, the MRC, and then they look at to see, well, what is it this year? It appears to be that if you look at the deaths from natural causes over the last 2 months, they are significantly higher than you'd expect in an ordinary year, far higher than the 4,500 odd that are dead. So does that therefore mean that actually our death rates are being significantly underreported?
Yes, it does.
Why are they being underreported?
Okay, they are underreported for quite a few reasons. First of all, to make the diagnosis of the COVID-19 and all the comorbidities that go with that can be for some staff or doctors, I'm not sure always in the public sector who fills in the deaths. It's actually supposed to be the doctor that needs to fill in, but if there's no doctor, it's only a nursing staff. It can be quite tricky, and then it's easier to say it's a dead body, the patient died because of an pneumonia, for argument's sake. So it is the way the reporting is being conducted is not feasible. This is a problem that's not only known. This is a long-standing problem that the quality of our death certificates are poor. The stats is not telling us the whole picture. So we know that it is underreporting. It's not underreporting because that they are too afraid to say it's COVID.
No, I appreciate it.
Underreporting, yeah. So it's underreporting just because lack of skills or.
But because of that, therefore, we don't have a proper picture. I mean, we've been on about the fact that our death rate to infection rate is very low, but in fact, it may be significantly higher than we're claiming it to be. Certainly, if you look at the UCT MRC study. So let me ask you this then. People watching this, I mean, you talk about the fact that many of the areas of our country, our medical facilities are just not up to, well, most countries in the world aren't, but we are taking a huge strain. Now, you guys advise the government on this. I mean,
yes.
Should we really then be at level 3?
The problem is, it's not going to make any difference anymore on what level you are.
Why?
The ship sailed. You needed, we had a small window of opportunity right in the beginning to get it right, to get the structures in place and to anticipate and learn from what happened in the other countries. And I'm sad to say that, yes, I think that the Department of Health, provincial departments and the command councils, and I don't know what councils there still is out there. There's a lot of councils and a lot of rigmarole and a lot of people who needs to say yes for one thing. So I think maybe they're working extremely hard, but you can work extremely hard and not productive. So during this time, when all of this should have been in place, there should have been a dashboard in place telling us every morning that there's so many beds in the public sector in Pretoria, so many beds available in the private sector. We know that it would be filled up by the end of the day. Tomorrow we start all over again. That should have been there. We should have known by now where there's a hotspot, how many doctors in a certain area and nursing staff are affected. There's nothing like this. We are still struggling with protective gear. We are struggling with information. There is no information. It's kept at a certain level. No one gets information. I'm asking you, give me 2 isolation hospitals in Gauteng, and I would be extremely happy to send my patients to that place. That information is not out there. Go and look for it. It's not there.
Let me ask you this. I accept that. I'm coming from this, please understand, as a lay person. I'm not a medical person. And most people who are going to listen to our discussion are in exactly the same boat as me. So you look at countries like America and now many others. Israel's another good example of that, where there particularly there was some praise for the fact that they'd done quite well. Then they opened up too quickly. America, certainly, that's classically the case. And now they've got a pandemic which is utterly out of control and highly unlikely to come back into control. Yes. So the question is that I accept that you know, when I spoke to Professor Gray, she pointed out to me that we couldn't afford to have a longer lockdown because we didn't have the economic resources to do that. I understand that, I get that. But I'm just troubled by the fact that when you got up to over 300,000 infections, probably underreported, deaths are underreported, and it looks like going up exponentially, surely if you look at other countries in the world, you've got to say to yourself, but we've got to be firmer rather than more relaxed. We can't afford to allow people to wander around to restaurants and cinemas and barbershops and good hairdressers and so on and so forth at this point in time. It's just going to kill far too many people. It's going to spread more than it should. That's what a layperson is thinking. That's why I'm asking you, why have I got that wrong?
No, you don't have it that much wrong. The thing is, you can only keep people under strict lockdown for a certain amount of time, and then they're going to get fed up with it. They're going to get build up resistance. And I must say to you, we are seeing a lot of anxiety. The consultations in the private sector that we are, and I'm in the private sector, and as I've said, I'm a GP for many years. So the type of consultations I am seeing during this COVID period, yes, I see my chronic patients coming for their blood pressures, but there's 2 major things. I see anxiety, and I am seeing a lot of backache and pain. So pain and anxiety, and I'm not unfortunately only seeing it under elderly people. I'm seeing it in the younger people and children, and a lot of this has to do with the family circumstances that is at home, or the fact that there's no one coming visiting me. I'm lonely, and the fear of the virus. So you cannot keep people under that strict lockdown for 3 months, 6 months. Not in South Africa. South Africa doesn't.
I appreciate that, but at this moment in time, when you open up your newspapers or listen to the television, and I accept you saying we're not getting kind of perhaps the accurate reporting we should, I don't know. But what I'm saying is, when people look at this, isn't there a sense in which if these hospitals aren't coping, you may have to do something sterner, almost more strictly, for a week or 2 or 3, just to allow for a slowdown? And if not, then how, and if you're right that we can't do that, then how on earth do we solve the problem that we're in at the present? I mean, you're advising the government, all of you experts are sitting there. What's your advice? Just to sort of hang in there, and we're going to, you know, just accept that we're going to have 40,000 deaths? I don't know. I mean, what hope do people have? That's what I suppose I'm asking.
There's not a lot of hope. You have to listen and to,
thank you.
Do what we say. Yeah, well, you know, I've been asked, you know, is there anything else that that the government can do? Just to give you an example, to answer your question maybe in this way, you know, the taxis that now can be 100% loaded for short distance. So I'm getting now this question from journalists asking me that, okay, it's now, you say, doctor, that they cannot be longer than 20 minutes in close contact. They need to open the windows. Isn't there something else that the government can do to make sure that the taxis can still be 100% full? Now, I'm telling you, this is my answer. This is a people's virus. This is not a political virus. It's not a trade union. It's not an SOE. You cannot go and sit and negotiate with this virus. This virus is saying to you, if you want me, be with me less than 1 meter, more than 20 minutes, close your windows, stay very, very close, keep me warm, don't wash your hands. And I promise you, I will go from you to the next person. I'm a people's virus. That's what the virus is telling you. There's nothing else. You have to open the windows in the 4 o'clock in the morning with a taxi if you want to load it full. You have to wear your mask. You need not to be longer than 20 minutes in face-to-face or close to contact with that person. You can eat.
Are we doing enough education to explain this to people?
No.
Let me give you an example. I walk up the mountain once or twice a week, socially distant from my friends, but with a mask, I might add, as I have to. But it is extraordinary to me how many people come either on bicycles, bikes, or walking down. Generally, I have to say, white people of the ages between 25 to 40, who don't seem to care less for me than anybody else for that matter, right? They arrogantly look at you when you shout for a mask. They think you're being outrageous. How do we start inculcating into people the notion that, in fact, this virus, they need to care for me as much as I need to care for them? I just don't see this happening. Oddly enough, I think it's happening much more in the townships than it's happening in some of the middle-class areas, but that's a sad reflection on our middle-class areas. But be that as it may, that's what I'm really asking you. What else can we do?
We have to reinforce the whole time the same mantra of the 4 things. Remember, it was always the 3 things: the mask, the social distancing, the hand washing. Now we are saying, with the new evidence that part of this virus might be airborne, that you have to open the windows. So, and people doesn't hear it. I had people this afternoon phoning me and said, listen, doctor, I've been in contact with this weekend with my mother's friend, and she's now tested positive. And I said, oh, did you wear your mask? Did you stay 1.5 meters away? No, doctor, it was at home. Well, that is the virus. This is the mantra of the virus. This is what the virus are telling you. Listen, and I will. If you do what the 4 things, then I can't get you, or I can get in a less way. Yes. But people doesn't hear it. You're absolutely right. They don't hear it because it's not going to happen to them. And only if they see people around them starting to die, that's when the penny is going to drop.
So let me ask you 2 questions. I'm running out of time. In terms of the kind of expert groups that are advising government, I mean, you're obviously privy to information that ordinary people aren't. So on the 2 issues, better therapeutic drugs which will help. I mean, we know there are a couple floating around. Is it likely in the foreseeable future that you doctors will have, let's say, more in the arsenal which will slow down the death rate? And what chances of vaccine?
I'm sorry, you asked me a question. If you want to hear the truth, don't think we're going to get better drugs. It is what it is. The 5 drugs, or 4 or 5 drugs that is being used in most of the countries, it stays the same. The last 3 or 4 months, we haven't seen any new development coming in. But the oxygen, the high flow nasal oxygen, this is actually what makes a difference to the treatment. If you can put that as a drug in, that is a very important drug. Then regarding the vaccine, can I give you the bad news? The bad news is it seems at this stage that there is not lifelong immunity. We said as well that herd immunity would be extremely important, but now it seems that the newest or the latest information is showing us that the body seems to only remember for about 6 months. The antibody stays only for about 6 months. It looks like that at this time. I'm speaking under correction. And that means that you can get it again. So
does that mean that if we have a vaccine, you'd have to sort of literally have it twice a year, sort of thing?
Well, that is what it. If it's going to stay what we think now, that is something that is what that might be. That might be in the pipeline.
It is true, by the way, that most of us who take the flu injection, you have to have a new one every year because it's a new strain.
Yeah.
But is there a possibility? I mean, people, I mean, obviously clinging to this hope. I mean, how realistic is the expectation that within the next 12, 18 months, we will have a vaccine?
Well, maybe we will have a vaccine for a short while. There is, well, I think we can safely look at about 18 months for that.
Would that be inclusive of South Africa?
South Africa is part of the trial.
Okay.
Yes, it will be. We're not excluded from that trial. Thank heavens for that. But remember, you know, as everything else, South Africa's got the, we are the king in TB, we are the king in HIV disease, and I think we are going to be, maybe the queen as well, under the king with Corona. I think because the way that it spread, as you correctly said, people, we don't have that culture. We don't come from a culture where we listen. We've come from a culture where over the many, many years, civil disobedience was always the norm. If you don't like something, you can go and toy, you can go and do something else. You don't need to go and work. You can just do what you want. So we're still trying to do this. We still don't have a lot of civilian obedience.
Frankly, I don't think we're the only country. Have a look at America just as an example.
Yeah,
that's why we're in trouble, because of the absurdity. But let me ask you this finally. The suggestion is on the modeling that we get over one way or another the peak by September, maybe October. What happens then?
Well, what they think and what they see in the other countries is that it's going to taper down, and then it's going to re-emerge again.
A second wave.
Yeah, there will be a second wave. Yeah, and remember what I've said: you can get it more than once.
Yeah, but I mean, but I suppose the point about the second wave would be at least it'll buy us some time to actually get things right. Because at the moment, what you're telling me,
yeah, I hope so. Well, just, you know what, I just need to say to all my colleagues and all the healthcare personnel out there, you are doing a great job. It's not an easy task. This is, it is to work with really, really sick people in an environment where you know that your own life is in danger, could be in danger anytime. It's extremely traumatic for the doctors and the healthcare workers as well. So we are going to go into a post-depression time and a post-PTSD time. And I think I would not be surprised if we will get suicidal behavior as well from some of these people.
Yeah, well, all I can say is, as we come to an end of, thank you very much for the conversation. I think it's an appropriate way to end, which is to pay tribute to the doctors and the nurses who do heroic work under very difficult circumstances. We seem to forget that. Other countries seem to sort of spend the minutes at night clapping their doctors and their nurses. We should be doing the same here, because from what you're saying, our situation is extremely parlous. So is there any light at the end of the tunnel? Let me end there.
I hope so. I hope that yes, there can be light at the end of the tunnel if we get the politicians out of medicine and we get the scientists and the doctors and the healthcare workers who know medicine try to solve this problem.
But aren't they, I mean,
make it a political thing.
But in fairness to the government, to any government, this is an unprecedented situation. And it does seem to be unlike the United States of America, that we've had a leadership here that has actually listened to scientists.
Yes.
Or am I wrong?
Unfortunately true. There's too many politicians, there's too many egos, there's too many committees that needs to say yes to one thing. To that thing, how many people do you need to fix a light bulb? So that is how it feels.
Okay, well, not for me to probe that. I was much more interested in my audience getting some idea as to what on earth is happening. You've been extremely helpful, and I have to say rather blunt, but that is fine. Honesty is what we need at this particular point in time rather than propaganda. So, Dr. Dr. Coetzee, thank you very much for your time. And all I can say is I hope that on some of these issues you are wrong. But as I said, time will tell. Thank you very much.
I'd rather be wrong and proven wrong than give you a false picture.
I agree with you. Thank you very much.
Thank you so much.